Today we're going to talk about some simple movements and exercises, my top three that we found are the most effective. They're by no means all of taking care of headaches, we call neck headaches, or cervicogenic headaches, all right? So stay tuned for that. We're just going to explain a little bit about what neck headaches are, but it's something that, you may be having some migraines that you think are just migraines, and sometimes there's actually, it's a neck headache, and it's not as common, but it's definitely a type of headache out there that can be solved with movement and postural things, and sometimes a little bit of strengthening. But we're going to go over the mobility exercise at the end of this video, so stay tuned. My name is Tom Wellman from Apex Orthopedic Rehabilitation. We're going to talk about the different types. So there's a primary headache, and then there's a secondary headache. So primary headaches are more your migraines, tension, and cluster headaches, okay? Those type of headaches sometimes have loss of motion. You may feel like you're a little tight in the neck. They do have that, aspect to it. Secondary headaches, the ones we're going to talk about, are much more significant. It can be from trauma, it can be vascular, it could be something really nasty actually. So you want to make sure that you know if that's the case for you. So you really want to screen this if you're unsure, okay? Underneath secondary headaches are neck headaches. That's headaches that you can feel that actually emanate from this upper cervical spine, especially that C1, C2 region, and it'll give you radiation typically along one side of the head. Primarily the one side can be into this region, kind of like radiating into this area, into the upper facial region, sometimes even some eye discomfort. Can be that. It also can be a primary headache. So as someone that's just trying to understand it as a patient, if you've ruled out that there's no other, you've gone to your doctor and he says this is not anything really to worry about, you might be dealing with a neck headache. So these movements will address any loss of motion for that type of headache, and oftentimes you'll feel like you can't look up as high. If it's on this side, let's say all your symptoms on this side, sometimes you'll feel like you don't have as much rotation to one side. So there's two things that may help you out. If you have full range of motion, there are people that say, I've got full range of motion and I still have this headache. It still can be coming from your neck. I would say these are not really common. It's much more common to have the primary headaches of like what we talked about, that migraine, cluster, and tension. But there are some that that have loss of motion, and some that don't. So you by doing these exercises, most times, if you listen to it and you listen to how you respond to these exercises, it should not make it worse. It's better to do these movements when you have a headache, because you can see a little bit of a cause and effect. That's the best time. Sometimes when we see patients in the clinic, they're not currently having any headaches, so we're giving them the best movement that we think really applies to them until they do it at home. But these are very simple movements and typically are neutral or better. If they ever make it worse, you want to immediately stop. So a good thing, if you're really concerned about whether you have a serious problem, is we use this acronym SNOOP, so S-N-O-O-P. Okay, and that'll tell us, basically if there's anything, you kind of go through that checklist. That'll give us in a sense if there's a higher risk for you having a headache that's related to a serious problem, or something that's kind of mechanical that might be solved with some movements and the exercise we're going to give you. So the first one is S, severe systemic type problems. You can have HIV, cancer, unexplained weight loss, fever. Those are some of the things that are part of that S. So if you have any of those risk factors, history of cancer, you may want to look a little bit deeper into possible reasons why you're still having trouble, especially if you don't see an immediate change once you do these exercises. Within a week or two, you're not seeing a change, you may want to talk to a practitioner, but that's the first one is S. N is neurological symptoms. So N, neurological, that can be confusion, decreased alertness, becoming unconscious. I think most people would understand that this is a serious problem and it could be connected to your headaches. The onset can be sudden within minutes, like quick, rapid progression. If you're noticing that, that's the kind of headache that we get a little more concerned about than something that's more gradually kind of getting worse and feeling, oh, it's getting there. So realize that sudden onset is more of a concern. Next one, quite frankly, is people that are over 50. I'm one of them. And also progressive. The headache's getting worse and worse. You're at a little higher risk for those more serious conditions when you're on that age group. In the younger population, might be just more simply posture and things like that. It's a less of a risk. Obviously, if you've had a lot of problems, even if you're under 50, you want to also consider that. But that's just kind of a line in the sand to consider. Age does affect. So the first thing we want to talk about before we start doing our exercise, we want to make sure we're in a good starting position. So the first starting position, we're going to show you this from a side view. We're going to turn a chair, preferably a chair. We want to scoot back as far as we can into the chair. And then if you could take a regular roll, this is an original Mackenzie roll. You can put this is a little strap you can put in your car, but if you're using it here, you're going to put it just above your waistline, and you want to lean back. So from a side view, you're in good alignment, you're getting the lower body in a good curve, and ears are the tip of the shoulder. Now this is your starting position. So we're going to do 3 exercises. The first one is a cervical retraction. So we want to feel like we're on a rail here, okay? So everything's kind of going straight back. So the retraction is pulling straight back. You want to feel like you're getting a flattening through here. And what we're trying to affect is that upper cervical spine in that area. In this area, what they feel like, we talked about earlier, that some of the headaches originate from these C1, C2. Those particular joints, some of the called facet joints, they'll give you pain referred into the head. And we're just trying to stretch those and put them in a better position, okay? So as we're doing this, this stretch called a retraction, I'll show you from the front view too. We're going to come straight back, and we add a little bit of pressure to it. So we push in, and then relax. Okay, that's one of the 3 ones that we did. And that'll change the position of the upper cervical spine where a lot of our headaches come from, like eye pain, jaw, up in this temporal region and up in this region. So anyway, so that's a cervical retraction. You want to do this 10 times every about 2 hours, and you want to hold it for about 1 or 2 seconds. You can take a finger like this, but make sure the pressure is straight back to the very end and release. Eventually, if we don't see results with this, we want to start including more time. And believe it or not, some people actually will hold this, put on a timer, 1, 2, 3 minutes, upwards of 3 minutes sometimes. We're holding that stretch. So hold that where you're feeling constant pressure and release. Now, the best time to try these exercises is especially when you're having a headache. It's still something you want to do when you have times when you don't have a headache to make sure you're keeping your range of motion. A lot of people lose a little bit, they'll be a little bit forehead, they'll lose this in that direction. And also, if you have, let's say you have a headache on this side, most of the times you'll see a little loss in motion, like we talked about earlier, to that side, which will be one of the stretches we'll deal with. But the first one is cervical retraction. So from a front view, nice and upright, eyes on the horizon, straight back. You can even use 2 hands. Pressure on, pressure off. But slowly increase the time that you're holding that end range position where it just doesn't go any further. And then release. It should not make your headache worse. All right? But these can be kind of nasty. They can be very hard to push. So you've got to keep, they find with headaches in this area, you really need to hold it for a longer and longer period. So start off with 1 or 2 seconds because it should make your headache worse. If it makes it worse for any period of time longer than a minute or 2, it's not the right exercise for you, and maybe you're doing something else. Second exercise is we're going to work on, so we're in the same setup. We're going to make sure we're in good alignment here, because if we do this retraction and we're leaning forward, watch this, here, and we're kind of bunching here. We want to elongate this area, all right? You'll feel some pressure in the front, but feeling that stretch, almost like you have a string on the top of your head, you're getting the elongation, okay? So the next one is same position. Second exercise, we're going to retract, and we're going to come forward like this. But we have to do that first part correctly. So we got to get that cervical retraction, the first one I showed you, retraction, and then forward. And you can add a little bit of pressure downward. Like we said, I would start with 1 or 2 seconds, 10 times every 2 hours. So about 5 sessions a day. That's a general format. It's especially powerful if you do it when you have the headache to see if there's a change in the headache. And it also tells you whether this is going to be influencing the headache. Sometimes you'll do it when you don't have a headache. It's still helpful, but it's especially good for the patient to know the difference if they can affect the headache symptoms at that time. Okay? Also, another good sign is if you start feeling like the headache is moving out of here and becomes more focal in the neck area where we think where it's coming from, the pain is whatever's getting irritated in this upper neck area, that's a good sign. If you have like some discomfort here and it starts radiating down,
that's not typically not a good sign. So just keep that in mind, and eventually you should just turn it off completely. So cervical retraction, and then let it flex forward. Make sure you're not getting all the motion from here. Make sure we're getting it from the neck, because we're trying to affect this upper neck area. That's where most of our problems occur. And you can do a gentle pressure on, even 2 hands. You don't have to pull that hard, but just gently apply pressure. Almost let the weight of the arms create the stretch. And then release. All right? Within 3 to 5 days of the point that you're feeling that headache, if it's depending on what's going on, you should see a change in that time if it's the right stretch for you. Like, you haven't had a formal evaluation, so you may not you may not be doing the right stretch for your particular headache. Right? And it also may not be a headache that's a neck headache. If you don't respond to 3 to 5 days, that's a good sign. Maybe we want to get a formal evaluation. All right, so consider that. Also, for people, not everyone has loss of motion at the neck when they have a headache. Some people are atypical, not the norm. They got great motion. It almost looks like they have full range of motion. Only until you do the stretches do you notice a change in symptoms. So it can throw you off sometimes, but especially when you have loss of motion, this may help you out. And you should see, wow, I've been doing these, I don't have a headache right now, but wow, I'm seeing an improvement in motion. That's a good sign. All right, so the last exercise is a few different things you can do, okay, to create this stretch. I'm going to show you one of them. So we want to work on, let's say our headache's on this side. We want to work on a little partial retraction and turn to that side, so as far as we can. Yeah, partial retraction, turn to the side. Hey, it feels all right, not making it worse. Feel a little looser in there. Great sign. So the way to progress this, so we add a little bit more pressure, like I said, start out with 1 or 2 seconds. 1, 2, back to starting position. And then eventually add time. You may have to, like I said, up 2 or 3 minutes, 4 minutes of holding that stretch. Long time, but if that long time turns off the headache, it's a winner, okay? So the other one you can do is you can do the retraction and then you can turn. Try not to turn through your trunk. That's why leaning against a chair and being in alignment helps out a little bit. Some people do this against the wall with a little roll. So you're going to retract partially and then you're going to turn. So you're kind of spinning something, like you're spinning your head. Here, across here, and here. 1, 2. If you have to hold it, like I said, for that longer period of time. Now, there's a few different ways you can also do this. Is Brian Mulligan, a physical therapist, famous physical therapist. He's shown a few different ways of doing the same stretch using a pillowcase. A towel isn't as effective. We really want that thin kind of pillowcase. If it's too thick, it's going to bunch in our neck. So if we're working on the rotation here, if we're trying to go left rotation, let's say our headaches are on the left side, okay? Because most of these that are neck headaches are on one side. So you're going to take your hand, you're going to take your right hand, so we're working on left rotation. And we're going to pull this around. And we want to kind of lay it right around below. You can see with me, it's like, this is the very bottom of my skull, and right about here. So we're going to take our right hand, we're going left rotation. Right hand, we're going to grasp this like so. Then we're going to take our left hand, so we're trying to work on rotation, and pull it across. Now you want to turn into the stretch. At the very end, hold that stretch. I don't know if you can hear me. Hold that stretch. 1, 2, and then back to the starting position. Retract a little bit, turn. And this gives you a fair amount of pressure at the very end there. It can really make a difference in the amount of pressure you can exert compared to this, if you do it right. It's a little awkward. People get a little bit like, which side do I grab? So you may have to do it a few times to get the right motion. If you really feel like it's helpful, we have these in the clinic, and this is a little device. OPTP actually has it. I'll put it in the description. You can buy one of these. Same idea. It just captures it, and it's a little more narrow, so you can kind of capture it, especially someone that's a little smaller, 6 foot about, a little less. For me, using the pillowcase isn't bad, but same idea. Working on left rotation, we take our right hand, we hold this down, and then we come up, and we turn, and rotation across there. Okay? And all we're trying to do is take some of these joints up here, and we're trying to create that rotation stretch right here. So our band is essentially capturing this area and trying to pull across and rotate it as this goes across the shoulder. That one is less common. I would start with the first one, the cervical retraction first, in that order. Cervical retraction with flexion, and then left rotation. You'll find with headaches, the ones that we're commonly giving you may not necessarily change it. If you get a formal evaluation and we take you through these, we may notice different movements make a difference for you and may change the headache. These are the most common. Go with the first two first. Try 3 to 5 days on the cervical retraction, no change. Cervical retraction with flexion. Listen, I hope this helps you out. Subscribe if you enjoy. I can show you other tips. Like us or place a comment here. I have some questions about how you're doing it and whether it's changing it. But keep in mind, this should not make it feel worse. If you feel worse, you're either doing it wrong or it's not the right exercise and you may need a formal evaluation from a doctor or a physical therapist. But physical therapists are really experts in this movement. Look at those. Ask them for some help, and this is something that's you can do at home. It can really make an impact on it. I tell you, headaches, I don't have a lot of headaches, and I got to tell you, when I get them, I would do anything I could to kind of get rid of them, and hopefully you don't have to rely on meds. Anyway, have a great day, and good luck fixing your headache.